Hello, welcome to Self-Healing Saturday. Today I wanted to do just a big focus on one of my kind of favorite lines, like my favorite kind of tagline to tell to people. And I wanted to talk about trusting your body and the fact that you can trust your body. And I think that's such a relevant thing to talk about when it comes to self-healing and German medicine and this greater understanding that we're developing, that we're seeing, oh wow, that there are connections, that your brain and your psyche and your organ, and understanding the whole process of what's going on inside of your body, and that there is not a randomness, and I think that really all, like for your whole life for the most part, if you kind of follow the mainstream as far as health goes, I mean, there is so much fear. Everything is fear-based. I feel like everything that you're taught in the medical world from the time that you're born. I mean, there's fear around the entire birth process. There's, indoctrination that your body isn't good enough, that your pelvis isn't wide enough, that there are things that can, that can and will go wrong. And it's like you're looking for things to go wrong, and there's just kind of this underlying fear that has been bred into us from this thinking that your body is weak, it can succumb to germs and all sorts of things that can go wrong. And so when you have this mistrust and this fear of your body, and you think that things can randomly go wrong, and that there are genes that can turn against you, and bugs that can turn against you, and an immune system that can just stop working properly, and then you can get sick, it's hard to have that trust when it's been kind of systematically designed in a way where fear, because fear is a big seller. I mean, and when you think about, business, things like medicine and selling you products to help you to ward off bad things from happening, you have to just use your mind and kind of expand your awareness of how people communicate with you about your body, and things that you can trust and mistrust. And we're kind of unpack this idea and topic of how can you trust your body if you have so much fear.
Yeah, for me, one of the things that's interesting about that is that it's not, it is in a sense sales from my perspective. It's also just about influence, just in general. And most people who are in the influencing game are of the opinion, and it is true that if you want to influence behavior, one very effective way to do that is to basically hell if you don't, which is basically that if you don't do this bad thing will happen. If you don't do this bad thing will happen. And, I think in medicine you see a lot of something that you also see in politics and government and in just a lot of human endeavors, which is this notion of the end justifying the means. And so if I can convince myself, or if a committee or a standard of care or whatever group convinces themselves that it's so critical that everyone, or that some subset of everyone, does a specific behavior or refrains from a specific behavior, the human mind is very adept at justifying any and all means necessary to get those people to do that behavior. And this is just kind of like, it's kind of funny. It's another example of a theme and a trend that's kind of been emerging in an unplanned way, I think, in our talks, which is that this human preoccupation with behavior and tendency to neglect experience, and tendency to neglect the significance of thought, and tendency to neglect the behaviors that will manifest from the thoughts that are induced in order to get you to do a specific behavior right here, right now. What about the reverberative thoughts, or the beliefs that kind of stick and continue to influence behavior outside of the context in which they were originally kind of implanted within you? For example, like the don't trust your body, take this medicine, do that, whatever. Like, it's not just going to influence that one initial behavior, but that's all that the persuader is interested in. Make sure you come see your doctor every so often. They don't say, oh, and what are you going to be thinking between this visit and the next as a result of the things that I tell you to think in order to get you to come in as often as I feel like you need to. And that was something for me, like when I was growing up around, whenever I'd go to the doctor and stuff like that, and especially when I was older and I wasn't necessarily the one seeing the doctor, but I was either going to visit someone in the hospital, or I had some of my siblings would be taken in, and I was much older by the time they were born, and so I would kind of witness my stepmom or my dad's experience with the doctor and relationship to the child, and all the thought processes that came up as a result of that stuff. And I was always very aware of the fact that it was like, there was the doctor and there was us. But then you can kind of step outside of that and you can say, okay, so but what are the logical thoughts and beliefs that are going to come from what's the aftertaste? What's the afterthought of the implications that are there? I think that's one of the things that's so powerful too about the current medical system is it's not even necessarily the procedures that are being done. It's the impression that one comes away with as a result of kind of being sold on the things that they've been sold on, which is to say, if it's necessary for me to do this particular thing because it's going to prevent my body from doing something, it's going to help my body to do something, it kind of leaves you with this sensation of health being a very kind of tenuous thing, and in some cases health being kind of an exception. And I think that's one of the significant things is it's not even necessarily the procedures, whether the procedures that are going on at the doctor are helpful or not. One of the things I'm really interested in is what are the kind of logical consequences in terms of belief and in terms of thought that the patient, on average, comes away with. I can't trust my body. Either my body is untrustworthy or my body is incompetent, right? So my body's either going to try to kill me, right? I have something where my body is working against me actively, and so medicine needs to basically force my body into compliance, or my body is stupid and my body doesn't really know what it's doing, and it's unintentionally but sort of idiotically doing something it shouldn't do, and so we need medicine to come and club it into compliance. And that's kind of like the default assumptions. The doctor doesn't necessarily say those things to you, and this is the really interesting thing to me about values transmission, and it's the things that are communicated sometimes implicitly that are the most powerfully hypnotic, or that do the best job at sort of establishing the entire context or the entire paradigm in which we think about something like health. And so, you go to the doctor over and over, you got to get these shots, and you got to go do this, and the doctor needs to give you this medication for this thing and that thing, and usually the treatments are explained in sort of like a layman's terms to the patient as one of two things. Your body's doing something it shouldn't be doing, we're going to give it this so it has to stop, or your body's not doing a very good job of doing something that it should be doing, and we're going to give this to help it. And you kind of constantly are exposed to that, and pretty much the only time anyone thinks about health, for the most part, right, the average person, they think about health when their health is threatened. They think about health when their health is going wrong. They think about health when they see things in the news that are likely. What's the thing that's most likely to kill me? Is it the flu, or is it heart disease, or is it cancer? That's typically when we think about our body. And I think that when we have those kind of reference points, when most of the time when health is discussed, it is about bad things happening to us, or it's about really awful things we have to do in order to avoid bad things happening to us, eating bland foods and having colonoscopies, right? I mean, truly, that's how people think about health all the time. It engenders, it motivates, it incentivizes kind of a dissociation, I think. I don't even want to think about this. And that sets up kind of an out of rapport. There's almost an alienation between you, the you that you experience yourself to be, and your body. And it's almost as if your body is kind of like this, sort of a pain in the ass clunker car. And it's like, you better not die on me here. You better not give out on me here, because I've got things I want to do. Don't hurt, don't break down, don't do this, don't do that. Oh shit, you got to charge up for 8 or 9 hours every single day. What an inconvenience, you know what I mean? And it really creates, I watch this in my own life, it's possible to become really kind of out of rapport with and almost resentful of your body. And I think that experience has significant health implications. I think that that's a really important thing. I think that it matters substantively. I think that it matters as much as things that we're paying a lot more attention to, like your diet or your exercise patterns or your genetic history or whatever. I think that tendency, what happens like in any relationship, so I kind of posit that there's a relationship between the you that you experience yourself to be in ordinary waking consciousness and your body. We can think about there being kind of a relationship there. And what happens in a relationship when the only time you talk to a person is when you want something from them, or when you have some kind of a problem with something that they're doing? If your husband or your wife or your, or perhaps your employer, or maybe your employees, or your boyfriend, your girlfriend, your children, whoever, the only time you ever talk to them, or perhaps the only time they ever talk to you, is when they've got a complaint or when they want something from you. That does not really do a lot for the quality of that relationship. Do you know what I mean? Mm-hmm. It erodes the quality of that relationship, and it just creates a situation where there's less harmony existing between the two. And I think that's a lot of people. I think that the predominant thoughts that they think about their health are away from what they don't want, and things that they want to avoid, things that they want to stop and prevent. And I think that's significant. I think it matters.
It is, and the undermining of that intuition, I think, is one of the really the detrimental things of the way that we are indoctrinated to think about our health is that you can't trust yourself, you can't trust your own intuition. And that's even like you've got to go in and have your yearly checkup. It's like you need someone to tell you that you're okay. You can't just check inside and know that you're okay. Like there is no way of knowing. So we need to look in here, we need to probe this, we need to like get in and look at these things because you don't know if you're okay. And really, I mean that like the kind of the mother's intuition, the grandmother's intuition, this like knowing that you have about your children, the medical doctor doesn't know your child. They don't really know you, they just know protocols. And so when you don't trust yourself and you have an intuition, but even if the doctor gives you, I remember my little brother was hit by a car when he was young, and they're like at the hospital, but they're just kind of like, waiting around, and he's like in a hallway, and I think like my parents, they just knew something was really wrong, like something bad, like, and that, they're just on a checklist of like, oh, he's not he's not bleeding that we can see, so he's kind of like down on the totem pole of getting checked out, but they like demanded that someone saw him, and it turned out he had a subdural hematoma, like a bleed in his brain, and like they just knew, and so that knowing, that like intuition and being able to check with yourself and kind of know things about your body. And that's why like you are your own best doctor. You really are. And when it comes to really understanding the 5 biological laws and knowing that it's your psyche, it's your interpretation, it's do you have an active conflict going on? Are you sending messages to your body to be in an adaptive mode? Only you can know how you're feeling. Only you can be truly checked into that. And by the time something appears on your physical body, and you go and you have someone look at like the physical stuff, they're not looking at the things that led to it. They're not looking at the true root cause. They're just seeing the outgrowth. And when you keep going after the outgrowth and you keep going after, truly the growth, if there's a tumor, if there's something in your body that shouldn't be there, but you're not paying attention to its development, and then you start to fear, why did this even happen? I didn't even know this was going on. That fear, that mistrust, that just kind of, I'm scared and I don't know what to do. Let me go to someone who thinks, who claims to know exactly what needs to be done. And that's the interesting thing really about medicine, because it really is protocol driven. It's driven by what is the standard of care? What do I have to do in this situation? And when you are just solely going on that and you don't have an understanding of your own body, and that's why, not everyone is a doctor or has a history of knowing, all of anatomy. Most people don't, if it's not your profession, don't take all that much of an interest in it. But knowing, because, you have this physical body, you are the operator of this physical body, having some level of understanding. And that's why, I, with the GNM material, making it as accessible, as understandable to just the layperson, to the individual who wants to know about their body, because they have a body and they have to operate it. And that's what I want, is that comfort, that trust, that knowing that you can trust your body, that your body is programmed for survival. It's not programmed to hurt you. It's not programmed to kill you. You don't have these genes that just turn on and off at random, that, they turn these cells on and grow and grow and grow with the goal of ending your life, because that's what a lot of people think. They truly feel like cancer is this inner enemy. They feel like disease is an inner enemy that they need to fight off, rather than in the GNM model. And this perspective is, it's something that you need to get to know. You need to develop this level of self-understanding, of body awareness, of why would my body be responding in this particular way. And that's what's so amazing, is you get into that rapport with your body. You come to an understanding of you had an emotional shock, you had a trauma, and that caused your body to make changes. And that, to me, is just so allows you to relax. And then realizing that every bit of information that you encounter, you can relate to that information in a way that makes you feel more scared, more nervous, or more relaxed, more in control, more okay with what you choose to do moving forward. And that's the thing about like interventions, and what are you going to do, and what treatments are you going to accept and not accept. truly, it's got to come from a place of what is setting you most at ease. Because when you do things, like Steve said, to move away from fear, to move away from what you don't want, any decision that you make from a place of fear, from a place of being scared of, I don't want this bad thing to happen, so I'm going to do this, that decision made from that fearful place is never going to get you closest to where you want to be.
Because usually what happens when you do that is that you carry with you that away from focusing pattern into the course of action that you choose. And so if I'm, let's say, choosing between holistic and conventional treatment, and I decide to go with a conventional treatment, whatever my situation is, and I go with conventional treatment because I focus on what might happen if I don't, and what I don't want to have happen to me as a result of not doing the right thing. The problem is that I'm going to carry that, I'm going to focus on what might happen as a result of what I'm doing or not doing, what I'm not doing. I'm going to carry that focusing pattern, I'm going to carry that experiential pattern very often with me into whatever behavioral decisions that I make. And really all that we're saying here is that that's really significant, right? Is that the way in which you're relating to your course of action, if you're doing things that constantly undermine, that's a creative act too, and that there's this inextricable link between what you think about, how you feel, your experience of your feelings that comes largely from what you think about the fact that you're feeling the way that you are and what you decide your feelings mean. That matters a lot in terms of your behavior, the actions that you take. It matters a lot in terms of the bodying that you do, the physiological processes that go on. And I think one of those things is just medicine really should come with some kind of a disclaimer that says, and this is true of a lot of different things, that says we're dealing with really easily, for us currently, quantifiable information here. And if we don't ask you about things that aren't really easily quantifiable, so for example, like your intuition or how you're feeling about a course of treatment, if we make it seem as if the only thing that matters is that you do what we want you to do or what we suggest that you do or what some randomized control trial said that you need to do, it's not that we're emphasizing that because it's the only thing that matters. It's that we're emphasizing that because that's the only thing we know how to talk about, because it's the only thing that we know how to measure. And if we can't measure it, we're not allowed really to talk about it. And that's absolutely true. Mm-hmm. But people don't necessarily understand that. People don't necessarily come to the doctor. They come to the doctor and they assume that the doctor is an expert in everything that's relevant to their health. Absolutely not the case. The doctor is an expert in everything the doctor is an expert in. And very often what the doctor is an expert in is a very small subset of what is really relevant for your health as a human being. And oftentimes some of the most significant things that determine your health as a human being, as an organism, as an entity, are things that really no one is an expert in, except perhaps you. And you could be an expert if you were aware enough and if you were in tune enough with your own process. And so, for example, like the fact that intuition isn't really talked about, or the fact that the quality of your experience at your yearly checkup, they ask you about what you're eating, they ask you about your exercising, they may ask you something about your stress level. But even that, you see, there's a pathological connotation to that. They don't ask you about fulfillment. They don't ask you about the feeling about what it's like to be you in the morning time when you're laying in bed going to sleep. And there's a strong implication there that stuff doesn't really matter. What matters is, are you eating Cheerios and are you walking at least 45 minutes a day, right? Those are the things that are really, really important. And, eating the eggs or not eating eggs, depending on what decade it is. And there's that strong implication that if it mattered, the doctor would be asking me about it. And if the doctor didn't ask me about it, it probably doesn't matter. So to hell with that stuff. I got my hands full eating this nasty food I don't want to eat and doing these exercises I don't, or whatever. And I think that just recognizing that a lot of people aren't asking you certain questions, not because those questions aren't good or important. They're asking you those questions because they wouldn't know what to do with the answers if you gave them to them, right? Because they probably don't know what their experience is. They don't know the first thing about improving the quality of what it's like to be you, because they probably don't necessarily pay that much attention to the quality of what it's like to be them. And there's this just constant implication that your experience doesn't matter, that it's not that important, or that your experience matters only in as much as how you're feeling influences what you do, and it's very important that you do what we want you to. And when you begin to recognize, when you begin to sort of kind of tap into ownership, a personal responsibility really, that recognizing the inherent responsibility that every human being has for their experience of what it's like to be them, for their existence in a human body, in the sense that the only person who is stuck with the consequences of your decision about what you're going to think and feel and do is you. And other people may have their own experience of whatever comes of you thinking and feeling and doing the things that you do, but that's their experience and they're responsible for that. But just recognizing just the absolute central role that the quality of your experience plays in everything about your life is really important. And I think too, learning how not to be led by things that are sort of implied unimportance. Things that people just don't talk about. Well, it's not that people don't talk about this stuff in your experience because your experience doesn't matter. They don't talk about it because they don't know how to talk about it. They don't even really think of it as a thing. It doesn't exist as a construct for a lot of healthcare practitioners. And if they did know that it mattered, they wouldn't really necessarily know how to talk about it. They wouldn't know how to advise you. Oh, you're feeling unhappy. I mean, what the best case scenario, what happens, you get sent to a psychiatrist or a therapist. Lord help you then. I mean, that's not necessarily a recipe for an extremely fulfilling and thriving lifestyle. Do you know what I'm saying? So even if you, best case scenario, you get referred to the medical or the psychological, the clinical professionals in the area of the mind and the psyche and well-being. And in some cases, that's the worst place that you could possibly go. You'd be lucky just to have your GP say, yeah, eat your Cheerios and do walking. And so I think just recognizing just that central nature of experience is hugely important. And watch the little meanings that happen in your mind when you leave the visit, or watch the kind of aftertaste of an interaction with the person about what seems to be important. So that's the thing for me, is like I would come away from the doctor and the doctor would tell me I had to do something. And I would sort of say, well, I want to talk to the doctor about it. I want to say, well, what are the implications? I mean, I remember one time I had like some complexion problems and they were kind of nagging. It wasn't severe, but it was just kind of like an active and an ongoing kind of like agony, basically. And I'd had it at various points before, and I'd gone to see a dermatologist, and he was kind of like your nice old-fashioned dermatologist. He'd give you a little topical cream that was his brand that was pretty good, and he'd give you some antibiotics. He'd just throw those things at you, right? So whatever. And so I did that for a long time. Well, then he died of a heart attack in his office. He just dropped dead. And so I like the guy. That was unfortunate for me. Like, he was a cool guy. I had to go find a new dermatologist. And so I went to the new dermatologist. Now, this guy was a strange kind of man, very intense, very kind of like he was processing you. He wasn't interested in you. He was sort of interested in your skin, and he was interested in the prescription that he was going to give you, so that he could get your money and get you out of there. And he prescribed, or he said, I'm going to have you, do this Accutane. And I had heard about Accutane, and it seemed like kind of a serious, pretty big deal kind of thing. But so here I am, I'm there as the patient, but I'm also kind of watching this whole interaction. I'm watching this man and his treatment of me. I'm watching my reaction to his demeanor. I'm watching myself be influenced by his intensity and by his air of authority that he had, his almost dismissiveness of my questions. Because if you ask your doctor a question and the doctor dismisses that question or patronizingly kind of politely brushes it aside, there's a part in you that says, oh, I shouldn't have even asked that question. It was wrong to ask that question. You can ask a question and have someone say, oh, no, that's actually not that important. We don't really worry about that here. That's one thing. But it's also possible that their response implies, that doesn't matter, and I'm a little annoyed that you even ask it. Don't ask me stupid questions like that. Just sit and listen to me and put the pill in your mouth, get the prescription, and do what I say. And so this guy was kind of like that. And he gave me this. I mean, I'm talking about like not a piece of paper. He gave me like a pamphlet, like as if I was going to buy a timeshare or something like that. But it was a government mandated, like a federally mandated warning label about if I was going to have this Accutane, about all the things I had to swear that I was going to do. And your face might crack open and you're going to have to put petroleum jelly on it because it's going to be so dry for some people. And if you've got a girlfriend, make sure she doesn't touch this stuff because it's going to give your child birth defects, right? I'm talking about like, not if she's pregnant, if she's like a fertile, potentially female, if she's not on birth control, make sure she doesn't touch this pill. Like, I'm going to take my pill. Oh, there's the phone. Let me set it down on the bathroom counter, and the girlfriend touches it. Like, you know what I'm saying? So I'm reading this thing and I'm like, holy shit, this is pretty intense stuff. I've got like a little blemish here and here, and I was wondering if this guy could, get me like, flawless in my complexion. That's all I'm in for. I didn't know I was going to be, having to sign off like a sort of a nuclear waiver form. And I asked, and the guy said, all right, read this and sign it, and I'll be back in a minute. Rushed out of the room. Came back and said, have you signed it yet? And I was like, I'm kind of a little kind of like unsure about this. This seems kind of intense. I mean, look at all the stuff. And he's like, no, that's not, you don't worry about that. Just sign it, right? Don't worry about that. Just sign it. Excuse me, right? And he was offended. And I said, can't you just give me what the other guy always did? He gave me a topical and he gave me an antibiotic, and it always worked just fine. This is way before, like when I just, the idea of taking an antibiotic to me at that point was just like, why not? And he was offended that I would question his authority. He was offended that I didn't have such confidence in him, that I was unbothered by this like 17-page pamphlet with a biohazard thing on it and a federal warning that says, I know that all this crazy shit might happen to me if I take the, basically it's going to dry me up from the inside out, potentially. And he was upset that I didn't have such blind confidence in him that I could read that and just say, well, the doctor said so it's totally fine. And I came away from that thinking, holy, there's something seriously wrong, right, with... At least things can go wrong. Not that they necessarily always do. I think if I wasn't really paying attention to my experience, if I was going to be allowing myself to be sort of influenced by this in the way that the trajectory of the conversation kind of was set up to influence me, I would come away from this feeling foolish for having any concerns. I would feel as if I had no say whatsoever in what my body was doing. I would feel as if my intuition that certain things about my body or certain recommended treatments weren't a good idea. I would come away thinking that I was not to be trusted, that it was a source of embarrassment, and how dare I distrust or even ask a question, literally ask a question of a learned professional who knows more about what the federally mandated government warning means than I could possibly know. As just a stupid layperson who's going to be ingesting this stuff, right? I mean, hell, it's just my body or the doctor, right? You've got the degree, I've got the body. And that was just a strange experience for me. And it was like, okay, so imagine situations, and that's the most superficial thing ever. I wanted clearer skin, right? Imagine if I had a potentially life-threatening condition or something I understood to be a potentially life-threatening condition. Imagine if it was about my child and my child's well-being, and this asshole was talking to me in these terms and basically guilting me for having sort of a parent's intuition about what my child might need or something like that. You will come away not just doing something that's potentially not that great for you, but the thing is, even if that course of treatment was right, you might have like a fundamentally crippled confidence in your intuition about what's right for your body, and you'll carry that shit with you for the rest of your life, and you'll teach your kids, just listen to the doctor. You don't want to ask the doctor any questions because they know things, right? This is like since time immemorial. This is how smart people get themselves to do stupid things, is that they assume that authority figures who are asking them to do things that make no sense whatsoever must have good reasons that we just can't quite understand. And so I'm going to just systematically tamp down my own intuition because I don't want to embarrass myself by asking a stupid question, so I'll just avoid asking any questions at all, and I'll trust the doctor. Do you know what I'm saying? The problem with standard of care, though, and the problem with doctors telling you to do this certain thing, the problem with there being this kind of standardized, when the system takes precedent and the system tells you what's right for you, is that if I'm a doctor and I follow standard of care and I recommend treatment to you and you die, you die, I don't get in trouble for that. I followed standard of care. That's the only basis for me, right? Is did you follow standard of care? In chiropractic school, they didn't tell us anything about things to avoid doing so patients would die. They told us about things to avoid doing so that you would not get sued. That's the thing. You follow standard of care. If you see this, this, or this, you must do this. If you see this, this, or this, you must do this. You have to say this. You can't say this. These things must happen this way. So much of the medical professional or the healthcare professional's mentality is taken up based on what algorithms to follow so that you don't wind up on the spit. Not about creating health outcomes. It's not about that. You are punished, you are rewarded, you live and you die by the degree to which you follow the standard of care. You do the shit that people told you to do, that you learned to do in school. Now, you can understand why that would be, you can understand the motivations that would be behind that. But now this is interesting. If I don't follow standard of care and I treat you in a way that is not recognized or not generally accepted, and you get well, I can get in trouble. I can get in trouble for that. People regularly get in trouble for because from the position of the medical, the board or whatever who establishes these standards of care, if you don't follow standard of care and your patient doesn't die, you just got lucky. In fact, if you don't follow standard of care and your patient is cured, you just got lucky. Spontaneous remission happens all the time. We're going to get you in trouble, though, because you didn't follow standard of care. If you follow standard of care and your patient dies, well, probably they were going to die anyway because they just had a severe illness, you see. But you did the right thing. You followed standard of care. And so there's this bizarre, unintended consequence of regimenting healthcare professionals into these locked-in modes of procedure. Now, that's not to say that there won't be problems if standard of care wasn't a thing. There certainly will be problems there too, but it's important. That's not the reality. The reality is that we have a situation where healthcare providers are bound by standards of care and where they live and die by following that, not necessarily by curing patients. And so when you as the patient walk through the door, no matter what that clinician, what their desires are for you as a human being, they value their own life more than yours. They value their own profession more than yours. And they don't consciously even make this decision. psychologically, right, there is a block against deviating from standard of care, and you think that's not going to have an effect on that doctor's intuition. You think it's not going to quiet down a voice that might say to that doctor, for this person, this might be really important, but what if doing this thing's outside of standard of care? It's not even going to enter their consciousness because they've been systematically trained. Don't even listen to those thoughts. They're not evidence-based. Follow the standard of care. Follow the standard of care. How many disease processes do you think follow standard of care? See, disease and health, they're not following these stupid rules that human beings have made up about what's supposed to happen. And when you are locked in to a certain pattern of behavior, this is one of those things for me, and I'm working with people psychologically. If I'm working with someone who's got this dysfunction, that dysfunction, whatever, they have this mental illness or that mental illness, they've got this pattern that's not serving them, that pattern that's not serving them. If that person has more flexibility than I do, if they have more freedom in how they can think about their world, their reality, their situation, their interactions with me, then I have freedom how I think about my world, my reality, my interactions with them. I can be of no service to them whatsoever. I can offer them no improvement whatsoever because they're already more flexible than I am. And that's one of those things, too, about recognizing anything to the body, is that the body doesn't care what the medical profession's understanding says that the body must do, can't do, shouldn't do, ought not do, is incapable of doing. And I think just being aware of that is a really important thing.
Oh, it's huge. And, I mean, that's really interesting just about the overriding and the... unfortunately, inherent arrogance that tends to be in the medical profession of, we know things that you don't know. We know things that you can't know. And I remember reading somewhere kind of an interesting analogy between how religion and also medicine uses Latin, which, these really fancy words that, nobody understands. Like, oh, you have, idiopathic arthritis or something, and like even the word arthritis, it just means joint inflammation, which you could understand if you just knew the breakdown of the words, but it's just realizing that the whole kind of system, it's designed in a way to make you feel like you're not smart enough to know about it. And both of those situations are kind of designed to take your power away.
That's really interesting, because I think that it's designed to make doctors feel smarter about not knowing anything.
But then what do? You just trust the person with the degree. I mean, that's what so many people do. They say, well, the doctor says, well, if it wasn't safe, then the doctor wouldn't let me do it. If it wasn't safe, the government wouldn't let me eat it. And we have this assumption, because there are people, who know more than we do, and we just say, well, that's their area of expertise. I'm just, Joe Schmo plumber, and so I don't know anything about my body, so I just trust these people. And so just taking back ownership of your own physical organism and realizing that you do need to know about your body, and that your understanding of the functioning of your body is of such importance. And so few people, no one's getting paid because you trust your body for the most part. No one's making money because you have an understanding of your body and how it works, and you know the 5 biological laws, you know why your body would go into an adaptive state, you understand why your body builds a scab, or why your body builds a tumor, or why your body erodes certain tissues. When you understand that, you become, you're in control, because you know why your body is doing certain things, and occasionally you may require some type of assistance from the medical profession, but you know about every interaction that you have with them, how your interpretation of it is influencing and coloring it. Just so many people I find just they're in the dark. They find out one day they've got a disease that they didn't even know that they had, and thank God for the medical profession that they found this terrible thing going on inside of my body. Now they're going to rid me of it, and there's so many different procedures and things that they're doing, and the whole time you're just like, I just want to stay alive. Like, here I am. I just want to live. But there is so much more that you can access, so much more that you can know, and that trust in your body, and realizing that, like, right now, your heart is beating, your food is digesting, your hair is growing, your cells are replacing themselves. There's like this miraculous thing going on inside of you that's being run by your brain, by you. There's another part of you that's running the show, and that your body doesn't do things randomly. And that is that, like, installing this faith, this trust in your body, in its ability to do what it's doing. And that's really why I find that like our background in chiropractic, because chiropractic, very much the entire philosophy is just your body knows how to heal. Like healing happens from the inside out. It's not going to be a pill, a drug, or something that you take that's going to heal your body. Your body heals itself. Your body is a self-healing organism, and it strives for life. I mean, all organisms strive for life, strive for living. It's always looking for a way to heal you, to fix you, to resolve a situation. And when you understand that what you've been experiencing as disease, what you've been experiencing as these problems going wrong in your body, it's actually if you saw the bigger picture, you'd see how right everything is going. You'd see that you were in a state of adaptation. Your body was making changes on the cellular level. You resolved whatever that situation was. Your body shifted into the healing mode. And then these other symptoms that you're feeling now, these are the repair process of these tissues being restored or the tumor being broken down. Your body is doing a process, and that's just the beautiful thing about this, about GNM, and about understanding, wow, my body, like, because I believed the body healed itself long before I knew about GNM. I knew that the body could heal itself, that there's innate healing capacity in every organism, that that life heals. It's the parts and pieces. What's the difference between, a corpse and a living body? It's the spark of life, and that spark of life is always seeking expression through the tissues, and that expression is always growth and healing and repair and life. It's never, it's never death. It's your body is trying to survive at all costs. It's, there are some things that will interfere with your body being allowed to express that life through your tissues. But when you just really start to believe, and you really are installing within yourself this inner faith, this trust in knowing that your body is healing, that it is trying to survive, and you just connecting the dots. And that's really what the work that I do with people and helping them to see the bigger process is just to know that you can trust your body. And that trust it just serves you in every situation, no matter what you do. Because it's not that, I would say, avoid all medical procedures. That's not the case at all. It's know what you're doing, know what you're feeling, and your intuition really is what should guide you. Because how many people do you know that say, I knew I should have done XYZ? I knew I should have done this, or I knew they should have done this. Like, they had an intuition, but because of fear or because of some reason they went against that intuition. It's like fear is really a self-fulfilling prophecy. If you fear something and then you go against, or if you have an intuition and you go against it, almost always that person says, I knew I should have followed my gut. I had a feeling about this, but I didn't do it because of what this person said or what that person said. And learning to trust that intuition and connecting yourself to your resources and understanding the bigger picture of what's going on in your body is so powerful. And so that's really the message that I want to get across to people, is that, everyone's telling you not to trust your body. Everyone's telling you, be scared of this flu, because it's really bad. I mean, every time, the news or there's an article on Facebook about how bad the flu is this year, how does that influence you? Are you aware of the way that influences you, of that way that influences most people? Truly, all of these contagions, it's fear. It's implanted in your mind, and it's these thoughts that you're thinking, these worries, these fears that cause the body to be in a state of fight or flight. And so just realizing that, how you're perceiving your world, how you are perceiving the symptoms in your body, how you are perceiving the diagnosis, and how that is communicating things to an ancient part of your body that says, all right, we have to prepare for a fight. And so that's kind of like the big message today.
Yeah, the thing for me about trusting your body, that's kind of interesting about this, is that it seems like a very hard thing to do until you realize, anytime I find that I'm confronted with something that I really recognize it's important that I do this thing, but it seems so hard to do, it seems so contrary to what I'm doing, I like to imagine the possibility that I'm already doing it and just not realizing it. So the interesting thing about trusting your body is, when you realize that your experience, when you realize that your mind, when you realize that what it's like to be you, when you realize that the you that you experience yourself to be is, in some senses, an outgrowth or a manifestation or an activity of the physical body, right? That there is a physical apparatus called the brain, that gives rise to and interacts in really interesting ways that creates the experience of what it's like to be you. I mean, it's like this network and that network get together, and then another network joins in, and then another network joins in, and then somehow or another they all join in such a way that suddenly the network begins to experience itself as something ineffable called I, and not a network, right? That's kind of a weird thing. And so when you recognize that, you recognize that whatever you are trusting, ultimately, whether it's the doctor, whether it's the sort of weird doctor, whether it's the people on Facebook, whatever it is that you decide to do, ultimately you're trusting your body. And if you're trusting your mind, if you're trusting what you trust, or if you're mistrusting what you trust, you're trusting yourself to mistrust yourself. How do you know to mistrust yourself in the way that you do? You're trusting something, some intuition or some anti-intuition or some contrary intuition, or you're trusting some assessment of outside information that's coming in. If you trust someone else, really what you're trusting is your assessment of them as a trustworthy person. Or you're trusting your assessment of the situation to say, I don't really fully trust this person, but it seems like it's the best option I have. I trust that intuition implicitly without even saying it to myself, and so I'm going to say I trust them. What I really trust is my assessment that they're my best bet. Ultimately, you are trusting your body because, your mind, your experience, this capacity, this is a manifestation of your brain, isn't it? And isn't that a part of your body that you are having a hard time trusting? And so you realize that even in mistrusting your body, you're actually trusting your body quite a bit. Now, when you recognize that, you can kind of just begin to dissolve into a state of relaxation, into a state of there's nothing I can do, there's nothing I can't do. Everything must be pretty much fine, at least on some level. And it may not be fine at a level of me that I normally experience myself to be, but I know that there are other levels to which I have access. I know that this and all insoluble problems, there's an extra syllable in there, you know what I'm talking about,
yeah.
Are illusions, right? Are the reason that I can't solve this thing is that it doesn't exist. You can't untie a knot that's not there. Do you know what I mean? And when you recognize that, there is this just capacity for relaxation. And there's a certain type of person, our culture is conducive to this, who says, okay, I do feel a little bit more relaxed, but what the hell do I do? Recognize and to be really aware of the fact that inclination to say, yeah, I got to the point where I feel better, now what the F am I going to actually do? Well, what you're going to do is to continue to stay in that place of feeling better and making decisions from there, learning to prioritize that experience, that state of well-being above everything else. You got to do that first, because even if there is some treatment protocol that's going to be necessary for you, and like the most mechanistic kind of allopathic traditional medicine way ever, even if there is some right path that you must take to stay surviving or to stay healthy or whatever, if it's the right path and if it must be taken, don't you think it's going to require a good decision to get yourself there? And when do you tend to make good decisions? Do you tend to make good decisions when you're in a state of fear, when you're pretending like you don't trust yourself, even though you're trusting your intuition that says not to trust yourself? Or do you do it from a place of just kind of like, for me personally, I make the best urgent decisions when I myself am not in a state of urgency. I make the clearest decisions when I recognize if I don't get out of the way, this guy's going to run me over, right? And so I just step out of the side. I waste no psychic energy at all saying, oh my God, what am I going to do, right? That costs a lot. And to the degree that you can get yourself, however you need to do it, spiritually or in terms of working with the belief, or for me it's just kind of a logical consequence thing, get yourself to that point of making sense out of not resisting where you are, who you are, what you're doing, what's going on, recognizing that you are trusting your body. Even if you're not trusting your body, you're trusting your body to give rise to a mind, to give rise to an intuition, to not trust your body. So you're trusting something. So there's nothing you can do, there's nothing you can't do. There's this kind of like, just relaxation to that. And it places you in a place where you're connected to your resources. And that's not the end. That's not the end of it. But that's where you start being a real person, responding to your reality. Because we can't really tell you how to there's a sense in which you're living in a different universe than we are. You're living in a different experiential universe. Reality is different for you than it is for us. The facts of the matter are different from you than they are for us. And so at the content level, it's really hard for someone who actually knows what they're talking about, to say, yeah, vitamin C is the way to go for you. That's the main thing. Vitamin C above all else. That's the most important thing for you to do. That's hard to do. At a pattern level, though, it's very easy and very responsible and it's always true. Find a way to connect to your resources. Find a way to unravel this ball of resistance and stress and emotional suffering that you may be creating within yourself, and create a space of clarity. Like, get yourself that blank canvas, experientially speaking, sort of untie a lot of the knots that have been tied societally, culturally, because of just those implied values that come from the medical system, that come from whatever. Not that stuff is bad, it's just that it tends to reliably produce kind of dysfunctional patterns of thinking and feeling in people and perceiving. Unravel all that stuff, and then what's left is this just beautiful clarity of you, and the fact that like you are your body is your mind is you, and you are your, you know what I mean? And there's this kind of like, oh shit, okay, it's all inside here. It's all, I actually have access to a lot of these decisions that I'm going to make, and that's actually a really good thing because I'm the one holding the bag, right? I'm the one for whom those decisions are going to be the most kind of immediately significant. Mm-hmm. And there is that kind of like, it's interesting kind of as social creatures, human beings, what are we going to do? Well, what is everyone else doing? Okay, well, what do the bosses in the tribe say? Okay, well, is everyone else listening to them? Well, I know someone didn't listen to what they said and then they died. And there's this kind of like, kind of like a social creature, social animal, kind of like look outside and see what else is going on. It's very easy to overlook what's going on within, and there are really crucial, critical variables, I think probably decisive variables that only you know about. And because only you know about them, nobody else is going to talk about them. Because nobody else talks about them, it's very possible and very easy to overlook decisive variables in terms of improving the quality of what it's like to be you, improving the quality of your health, possibly saving your life. Pay attention to that because you are kind of the repository of a lot of super valuable information. And the world will lead you to believe that information doesn't matter, but it's only because people tend to talk about things they at least feel they know something about, and nobody thinks they know what it's like to be you, so no one wants to talk about that because no one likes to be a hopeless non-expert. Do you know what I mean? And so just recognizing that's why no one's talking about it, not because it doesn't matter. Then you have to become an expert in you, an expert in what it's like to be you, an expert in your experience, the quality of it, where it's coming from, what you're doing, and then from that position, when you're really in touch with that, it doesn't mean that you necessarily have like instantaneous, like super abundant knowledge about practical health things to do, but you begin to be in a position where you can recognize what's going to make sense for you. And that's the point where you really want to get to, I think.
Yeah, so that you can, from a place of peace, from a place of ease, from a place of well-being, from a place of, you know what, there's no urgent, crazy thing I have to do right now. And that ability to see where you are, to experience what you're experiencing, and to even have physical pain, to even have something that something that you're healing, something that you're going through, to be uncomfortable, but to be able to say, you know what, I'm going to choose to not freak out about this. There is a time and a place for the body's fight or flight response, and that's for immediate physical dangers, like something that's absolutely happening right now, you've got to move. But if you've got time to think about it, if you've got time to reflect, if you've got, if nothing is crazy going on in the room that you're in right now, you've got time. You've got time to relax, you've got time to be at ease, and you've got time to explore your different options. And just coming from that place of my body knows what it's doing. I may not know what that is right now, but I trust that this conglomeration of trillions of cells that was just 2 cells at one point, but now is me and has been operating this very complex interconnected system as long as I've been alive, and it actually is giving rise to this weird stuff that's going on behind my eyes called my experience. I trust that. There's kind of a mysterious magic there that I don't fully understand, that I actually know that nobody fully understands, including, the most intelligent medical doctor in the world still doesn't know exactly what it's like to be me. And I know that my experience communicates deep to my tissues, to ancient parts of my body that only respond to fear and panic. And so if I'm in a state of fear and panic, I know that that's not helping my situation. I may not know everything. I may not know everything about the details of what even is the best path for me moving forward specifically, but I do know that whatever it is will be revealed through my sense of ease and well-being, not through me freaking out and being scared and being worried and being in a state of unrest, because that is a communication. So just realizing every thought is a communication. Every emotional sensation is a communication, that you are going to be, you're trusting your body, you're trusting your intuition one way or another, whether it's even trusting yourself to not follow your intuition, that is a form of trust. And so realizing that, using that as a way to relax, to not freak out about it, just another thing on your plate, because a lot of people really will reject any additional information, even about GNM, because they feel like I'm already literally taking 500 supplements, doing this many protocols, doing all of these other things, and it really, you know, in GNM, it's kind of like about relaxing it and taking away and seeing what is truly adding to the experience of, you know, allowing you to support what your body is doing anyways. And that's really, I think, always the best treatment is going to be, let's support whatever the body is doing right now, and, you know, and move forward from there. So anything else to add today? Thank you guys so much for watching the video. Please post if you have any questions, if you have any topics you'd like us to cover in the Self-Healing Saturday videos. We, this past week, released a new episode of the GNM podcast, which is wonderful. Yeah, so we are here for you for whatever you need. If you're interested in coaching or guidance or help of any kind, please send us a message, and enjoy the rest of your weekend.
Bye.